Atherosclerosis is a common disease. It affects the arteries. Arteries are blood vessels. They carry oxygen-rich blood from your heart to the rest of your body. Imagine them as pipes. Over time, these pipes can become narrowed. This is due to a buildup of plaque. Plaque is a sticky substance. It's made of fat, cholesterol, calcium, and other substances. As plaque builds up, it hardens. This hardening narrows the arteries. The narrowing restricts blood flow. This process is what we call atherosclerosis. Atherosclerosis is a silent disease. It often progresses without symptoms. It can affect arteries throughout the body. This includes arteries in the heart, brain, legs, and kidneys. Understanding atherosclerosis is crucial. It's the first step toward prevention and treatment. What causes this buildup of plaque? Several factors contribute. These are known as risk factors. Some risk factors are controllable, others are not. Uncontrollable risk factors include age. The risk increases as we age. Family history. Genetics play a role. A family history of heart disease increases your risk. Gender: men are at higher risk. However, the risk increases for women after menopause. Controllable risk factors include high blood pressure. It puts stress on artery walls. This stress can damage the arteries. High cholesterol, high levels of LDL or bad cholesterol contribute to plaque buildup. Smoking, it damages blood vessels. This damage makes them more prone to plaque formation. Diabetes, high blood sugar levels can damage arteries. Inflammation, chronic inflammation can contribute to plaque development. Let's take a closer look at how plaque forms. Imagine the inner lining of an artery as a smooth, Teflon-coated pan. This lining allows blood to flow smoothly. However, certain factors can damage this lining. These include high blood pressure, smoking, and high cholesterol. When the lining is damaged, it's like scratching your non-stick pan. This damage attracts substances in the blood. These substances include cholesterol, fat, and inflammatory cells. These substances stick to the damaged area. They accumulate over time. As these substances build up, they form a fatty streak. This streak is like a small bump on the artery wall. Over time, the fatty streak hardens. It becomes a plaque. The plaque continues to grow. This growth further narrows the arteries. Section 4. Atherosclerosis, a multifaceted threat. The consequences of atherosclerosis are far-reaching. It can affect various parts of the body. The severity depends on the location and extent of the blockage. Coronary artery disease: plaque buildup in the heart's arteries can lead to chest pain, also known as angina, heart attack, or heart failure. Carotid artery disease: blockage in the neck arteries supplying blood to the brain can cause a stroke. Peripheral artery disease: atherosclerosis in the leg arteries can cause pain, numbness, and cramping, especially during exercise. Renal artery disease: narrowed arteries to the kidneys can lead to high blood pressure and kidney damage. Aneurysms: atherosclerosis weakens artery walls, making them prone to bulges or aneurysms that can rupture and cause life-threatening bleeding. Blood clots: plaque rupture can trigger blood clot formation, blocking blood flow and leading to heart attack or stroke. Section 5. Unveiling the silent threat, diagnosis and detection. Atherosclerosis is often silent in its early stages. Detecting it early is crucial for prevention and treatment. Diagnosis involves a combination of medical history. Your doctor will ask about your medical history, including risk factors and symptoms. Physical exam: they will listen to your heart and blood vessels for abnormalities. Blood tests: these tests check cholesterol levels, blood sugar levels, and other markers of inflammation. Imaging tests: electrocardiogram, echocardiogram, stress test, ultrasound, computed tomography scan, and magnetic resonance imaging can visualize arteries and blood flow. Procedures: angiography involves injecting a dye into the arteries to visualize blockages using X-rays. Section 6. Combating atherosclerosis, a multi-pronged approach. Managing and preventing atherosclerosis requires a multifaceted approach. Lifestyle changes are crucial. These include healthy diet. Eating a diet low in saturated and trans fats, cholesterol, and sodium is essential. Focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular exercise. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Exercise helps lower blood pressure, improve cholesterol levels, and manage weight. Quit smoking. Smoking is a major risk factor for atherosclerosis. Quitting smoking is one of the most important things you can do for your heart health. Medications can help manage risk factors. These include cholesterol-lowering medications such as statins, blood pressure medications, diabetes medications. In some cases, surgical procedures may be necessary. These include Angioplasty, a balloon is used to open up blocked arteries. Stenting, a small mesh tube is inserted to keep the artery open. Bypass surgery, a healthy blood vessel is used to bypass the blocked artery.